But let's start on top. And look at that. The funny thing on top is that things actually don't look like a typical vertebra. They actually look totally goofy. But in some kind of, we can make it out a little bit. So if you take them together, you see the top vertebra is a ring. And then that connects with the head. And the second vertebra has a ring too, but it also has this thing sticking up. And actually when we put them together, that thing sticks up through here, through the front of the ring vertebra. And so evolutionarily speaking, if we're not living in Texas, no, sorry, that was a bad joke. But evolutionarily speaking, the dens reaches into that ring and attaches firmly to the front of that ring. And it used to be that this little thing called the dens on the second vertebra was the body of this ring vertebra. So that's how you can think of it. But what this construction helps us with, if we take it as a unit, it makes this top vertebra be easy rotational. It can rotate easily around this bottom vertebra, and therefore we can rotate the head easy around the spine because the head's attached on top. And so the top vertebra, the ring one, is known as the Atlas, because in Greek mythology, the Atlas would hold up the earth. And for us people, guess what the earth is? It's the head, the center of the universe. And that also is the first vertebra in the neck, so that's also known as C1, first cervical vertebra. And then secondly, we have the axis. And the axis has its name because it creates the axis around which the head can rotate. The dens sort of is responsible for that. And that also, of course, the second one, so we can also call it C2. Then in a typical rest of the cervical vertebra, we got a couple of pieces that stick out that we can say, hey, look, that's a cervical vertebra. It's a vertebra from the neck. And one of those things is it bifurcates. It's called bifurcate. Look at here in the back. The spinous process, it splits into two. And so that's a really cool feature because when we reach back with the head, those vertebrae, they will jam, those spinuses would slam into one another. And so having the top one lay on the bottom one by a bifurcated end, it lets it bend a little bit further back. And so that's kind of a cool thing. The other thing we see here is a hole in the side by the transverse. It's transverse foramen. It's a transverse foramen. Foramen means hole. And what goes through it is this vertebral artery. And the vertebral artery is important. It feeds the back of the head, the back of the brain. And so it's protected through this bony encasing. So that's kind of helpful with it. So those are the two features. Some of the main things that are different. Besides, it's a small vertebra. It has a few more other things, but that's pretty good. What I didn't point out to here, I think, that we can see here, look at this hole here, these holes here, that are made in between the body and also then those processes, those joints, those connections in the back, are the intervertebral foramen. So in between, inter means in between, vertebral means vertebra, and foramen means hole. So the intervertebral foramen are also an important structure that we can see here nicely because we have a stack of vertebra. That brings us to the thoracic spine. So the thoracic section, that's where the ribs attach. Look at this, is a nice picture. That's from below up. The body's here and the ribs reaching around. So you can see here how the ribs come from back and reach around to the front. And then here, this is the chest plate. So they reach into the chest plate. We'll talk about the chest plate too in a little bit. And then of course here we can see them from the side. We see that often. But what helps, the ribs help with is they protect the lungs. But they also help with a nice firm attachment site right here in this area for the upper extremities. And we'll see that when we go to the muscle. We have a serratus anterior muscle that reaches right into this area here and attaches the upper extremities firmly into the rib cage. But from a bony landmark perspective, what's important here is you see the rib coming back around and touch the transverse process, and then it touches the vertebra in the body of the vertebra. And actually what it does, it comes in from the side we could see that. We can't see it here, but on the models we could see it. It comes in between two body of the vertebra. So as it reaches around here, it touches the transverse. So we have a little indentation on the transverse process that's known as the facet of the transverse process. And that's a landmark that we can say, hey, that's a thoracic vertebra. And then as it comes in, it reaches actually around downward a little bit more and attaches to a little small facet here on the bottom of the vertebra. And then another one on the next vertebra below, that's actually the same one as here on this vertebra. So there's one on the bottom and one on the top. And those are costal facets for the ribs. Costal means ribs. So you actually don't need to say costal facets for the ribs. You can actually just say costal facets. But, you know, that way it's clear. And they're actually demi-facets. Demi means half. But those are nice things to see on a vertebra and say like, hey, that's a vertebra from the mid-back. That's a thoracic vertebra. We got 12 of those. The other thing that sort of indicates that's a thoracic vertebra is a long spinous process. It reaches like over a segment and a half inferior in its most extreme sections. And then the lumbar vertebra is just big. It's big and it has a spade-like spinous process. So you could take that spinous process essentially and dig a hole in the ground and use it like it's a spade. Well, not really, but that's what the description is like, so when they describe it. Okay. And that brings us to the sacrum. Oh, the sacrum is the bottom of the spine. Its terminology actually comes from it being a sacred bone, because when they take it, it's round. See, it rounds backwards a little bit and a little bit this way as well, so they can like have it as be a little plate and have some burning things on top of it, in, you know, animal sacrum. So they termed it, the Greeks termed it as a sacrum. There's a few things. So the sacrum is right here, comes down, and you see it has connections with the hip bone, so the iliac bone here. We'll talk about the hip bone in a little bit. Has it on two sides. And so we have naturally an area where we need to make a connection, a joint, and that's here, right here, on the side of the sacrum. So when you see that, that's called the auricular surface. Auricular surface. See here, auricular surface. That's like an ear. Auricle comes from ear. It looks kind of like an ear from the sides, sort of. But, you know, that's what the anatomists saw. And then, since the sacrum is fused vertebra together, we have these things in the back. This is from the back. And these little bumps are the old spinous processes. And these become the median sacral crest. And then instead of intervertebral foramen, one on the side that just comes out between the vertebrae, we got actually some that are holes in the back and then also holes in the front. So we have posterior sacral foramina and we have anterior sacral foramina. Interesting. Then when we look from the front, we can sort of see this like shaped like a wing on a bird from the body. And so these areas here are called the sacral ala. That's interesting too. And then I think we got one more term that I want you to know, and it's not on here really because it's in the front. So you could see here where the top arrow goes here, where the two vertebrae connected, the two bodies connected, and it used to be a disc. But now it's just a line. Sometimes there is a little disc, and there we got one of them in lab that has a disc in one of them, but most of the time these are fused. So those are known as the transverse lines. That's what they're known as. All right, so, and then below here on the bottom you have the coccyx. And that's, see, here's 3 segments, sometimes it's 5, average of 4. We don't need to worry too much about those structures. But then lastly we talk about the rib cage. So we have ribs, and actually the ribs have some parts to it. The place that goes right into the body, right here, is known as the head, and then we have a little slender part that's known as the neck, and then we have another bump that's known as the tubercle of a rib. It's on every rib, because that's the connection with the transverse process. But then the ribs reach around to the front, into the chest plate. And the chest plate is actually one bone made up of 3 pieces. The top one is known as the manubrium. Then the main big part is known as the body, or in old terminology, sometimes they call this the gladiolus. like in Gladiator, the chest plate. And then at the bottom we have a very sharp little pokey thing, and that's known as the xiphoid process. That is a place where the diaphragm attaches. The diaphragm is right underneath the ribcage and reaches back to the spine. And when we breathe, it actually contracts. And when it contracts, it moves inferior and makes the chest cavity bigger so air can flow in through the nose or the mouth. Because the gases want to be properly balanced. Well, we'll talk about that part. There's a pressure difference. That is the breathing thing. And so when we look at the ribs here, they attach to the chest, the breastplate. And so, the xiphoid, we want to be very careful about that, because if it breaks off, it has this tendon attached to it from the diaphragm, and the tendon will pull, and then pull it backwards, and it will pierce the liver, and it can kill somebody. So when you do a Heimlich and somebody chokes, you always want to reach below it with your thumb, with your fist, to push in. Do not break the xiphoid. Okay, so when it comes to ribs, we group these ribs into true, false, and floaters. We have ribs, the first 7, by the way, actually, they are right attached straight via cartilage to the sternum. Those are true ribs, 1 through 7. And then, look at this, there's the other ones. We have 4 ribs, 8 to 12. They are attached through a cartilage to rib number 7. And then at the bottom we have the 3 floaters. They don't attach to anything. Okay, so that's as far as that's concerned. And now let's keep moving forward. We'll talk about some joints, and then we'll go through the appendicular skeleton.